Good day. Today we will be presenting our grand case discussion, and the case that was assigned to us is case 1. The case that was given to us is a 43-year-old female patient who was diagnosed with cervical radiculopathy. She complains of neck pain that radiates down to her left hand, accompanied by a feeling of weakness on her left upper extremity. So to further understand the patient's diagnosis and why it presents such, we will be then tackling the following. Discuss the mechanism of the disease. Next, what are the different structure affected with the patient's condition? Next, give a special test that would confirm the patient's diagnosis. To start with the discussion, we will elaborate the mechanism of the disease. Cervical radiculopathy, commonly known as pinched nerve, is a clinical condition wherein a nerve root in the cervical spine is inflamed or damaged, resulting in a neurological function. It can lead to neurological deficits such as numbness, tingling, and weakness, in which it can radiate anywhere in the arm to the neck, shoulders, hands, and fingers. This condition can be caused by nearby bone spurs in the cervical spine, which are bony projections that develop along the bone edges that lead in the damage of the cervical nerve. It can also be caused by herniation of the cervical disc that occurs when the gelatinous inner disc material, the nucleus pulposus, ruptured or herniated through the outer cervical disc wall. A cervical herniated disc is caused by excessive stress being placed on the disc, whether as a result of heavy lifting or other damaging motions. Pain and other symptoms can develop when the damaged disc pushes into the spinal canal or nerve roots. Another cause is cervical spondylosis. The degenerative changes that occur in the cervical spine with age. The breakdown of the disc with age leads to decreased disc height and foraminal narrowing. This results in increased loads placed through the intervertebral joints, as well as the vertebral body. This in turn leads to bony hypertrophy, which leads to foraminal stenosis and cervical radiculopathy, which other less common causes of cervical radiculopathy are possible, such as infection or tumor. To know if you have cervical radiculopathy, here are some symptoms that can be presented. Pain that radiates down the arm to the hand or fingers. Next is weakness of the hands and arms. Sensory issues such as numbness or tingling in the fingers or hands. Lastly, motor problems such as muscle weakness, lack of coordination, or the loss of reflex in your arms.
Next, we'll be discussing the different structures that are affected by cervical radiculopathy. So the most commonly affected structure in cervical radiculopathy are the cervical nerve roots of the spinal column. The pinched nerve can occur at different areas along the spine, and it may be in the cervical, thoracic, or lumbar area. As presented in the case of the patient, it is observed that the C6 to C7 intervertebral foramen is narrowed, and thus the reason for diagnosing the patient for cervical radiculopathy. With the intervertebral foramen C6 to 7 narrow, nerve root C7 exits between the two vertebrae, thus it is the pinched nerve. This is why the patient complained of pain in the neck that radiates down to her left hand, accompanied by a feeling of weakness on her left upper extremity. The patient also complained that the pain radiates down to her left hand from her neck. This is because C7 nerve roots helps control the triceps and wrist extensor muscles, which is why patient can experience weakness in these areas affected, varying by the cervical nerves. Now, the C7 dermatome also covers the areas of skin covering the shoulders, back of the arms, and the middle finger. Other structures that are affected by cervical radiculopathy are the zygapophyseal joints, and these are true synovial joints that link adjoining vertebral bodies and provide directional stability to the spinal column. Dorsal ramus of the exiting spinal nerve innervates the zygapophyseal joint, and these joints can be a source of pain. Bony growth at the zygapophyseal joint and uncovertebral joints typically results in neural foraminal narrowing and compression of the nerve roots and radicular symptoms. Degenerative changes along the margins of the vertebral bodies and the posterior longitudinal ligament typically result in the compression of the spinal cord and myelopathy.
Lastly, We will discuss the measures done to confirm the patient's diagnosis. To confirm the patient's diagnosis of cervical radiculopathy, the doctor first should ask the patient to describe all of the symptoms and should review the patient's medical history. A physical exam test can be given to the patient wherein it will check the patient's neck, shoulders, arms, and hands for muscle weakness and problems with sensation or reflexes by asking the patient to move his or her hands or neck to see if certain movements cause or ease pain. Special exams can also be given to the patient such as X-rays, to look for narrowing of vertebral openings or disc injury, CT scans to get more detailed picture of the cervical spine, MRI to check for damage to nerve roots or soft tissues. Lastly, electromyography to see how the patient's muscles work when they are at rest or contracted. One of the main tests done to see if has cervical radiculopathy is the Sperling's test. This test can either simply tell you that you are positive for cervical radiculopathy, or there is still a need to run some more tests to assure that the patient does not have cervical radiculopathy. It's also called the Sperling compression test or Sperling maneuver. As part of the physical exam, Sperling's test enables the doctor to see if compressing the cervical spine can reproduce or worsen the patient's radicular symptoms. The Sperling test is done while you are sitting down, either in a chair or on an exam table. This test is typically done by having the patient bend the head to the side where the symptoms have occurred, and then the doctor gently applies pressure to the top of the head. This process will cause the cervical foramen, the bony openings in the spine where nerve roots exit, to compress and narrow, which might have the effect of compressing a nerve root and reproducing the radicular symptoms that the patient has been experiencing. If Sperling's test reproduced the patient's radicular symptoms, cervical radiculopathy is likely present, although it is common for cervical radiculopathy to still be present even if Sperling's test does not reproduce the symptoms.
Some of these additional tests include shoulder abduction tests, in which this test involves placing the palm of your affected arm over the top of your head. And if your symptoms go away when you do this, it's considered a positive result. Now, what do these results even mean? Having a positive result means the patient can feel or pain radiate into their arm during the test, and being positive for cervical radiculopathy means it is about time to start a non surgical treatment program. But if you're having a normal result, a normal spreading test result means didn't feel any pain during the test. However, a normal result doesn't always mean you don't have cervical radiculopathy. Doctors will most likely do some additional testing to check for other signs of cervical radiculopathy or another condition that could be causing your symptoms.
Now, what treatments can we do as a physical therapist to help our patient? Pain management. Reduce the pain and inflammation in the area. Ice packs applied to the neck and scapular shoulder blade region during the first 24 to 48 hours following the onset of pain to help reduce inflammation. Next is manual therapy, such as manual cervical traction to relieve pressure into the cervical neck region. Gently massage may be also performed to help the muscles relax and improve circulation to the area. Next is posture education. There will be adjustment to the workstation and work habits of the patient to promote good posture to protect their neck.
We also have range of motion exercises, in which this is to teach the patient gentle cervical mobility exercises to relieve symptoms and allow return to normal movement. None of these exercises should increase their pain. We also have strengthening exercises. Physical therapists will help determine what muscle groups need to be strengthened based on which spinal nerves are involved in the case. Lastly is functional training. As symptoms improve, functional exercise will be done to help patients return to their job, sport, or other daily activities. Depending on their lifestyle before having cervical radiculopathy, the exercises will mimic the actions of what they do in their daily activities. So now that is all for our case discussion. We hope you have learned something from our short presentation. We are now ready for your questions or clarifications.